Good afternoon, everyone, and welcome to the Ontario PSW Association Town Hall. My name is Miranda Ferrier, and I'm the CEO of the Ontario PSW Association, and I'm joined today by my Director of Operations, Ian De Silva. And we are here today to answer your questions and concerns, as well as do a bit of housekeeping, tell you guys what's going on in the PSW field as much as we possibly can at this point, and go from there. So again, some more housekeeping. If you guys have questions, please feel free to put them in the chat or in the Q&A buttons that you will see somewhere on your screen. We'll do our best to answer all the questions in order as best as we possibly can. It's a very laid back town hall. It's just us operating this in the chats. So we're going to do our best to accommodate everyone. Please know that this is a safe zone. So if you have questions, concerns, don't be afraid to ask those questions. If you would like us to answer your question and you keep yourself anonymous, please make sure to click on the chat that you just send the message to panelists and hosts, and we will answer the question and not mention your name. So we are all about keeping everyone comfortable, everyone happy, and make sure that all your questions and your concerns are addressed on this town hall, as it is what it is. So again, welcome to everyone on, I don't know where everyone is in Ontario, but I'm in Waterloo region, and it is a dreary, cold, and rainy day here, although our spirits are high because we do have some as much information as we can share, announcements right now coming down about PSWs in the province of Ontario. Ian, do you have anything you'd like to share?
Just to echo the same sentiments, so hope everyone, please feel free to ask any questions. If there's a question that you do not want us to answer, something that you need confidential, or something related to a membership profile question, or specifically related to your, please email us directly. We'd be happy to answer them. We are getting a bit of an uptick in emails right now, so you got to bear with us a bit, but we are doing our best to accommodate every single member.
We do try. We absolutely try.
Sarah says Niagara is wet and dreary. We know, Sarah. We're hearing it's rough down there right now.
We're hearing it's very rough down Niagara region right now. So sorry to hear about that, and stay safe. Okay, so to get things started, what is happening in the PSW field? Well, I'm going to just get started here, Anne, and talk about a few things that are incoming that we get a lot of questions about here at the OPSWA. And one of those questions is, of course, when is PSW regulation going to happen? So for those of you that are on this call that don't know what is occurring with PSWs in relation to regulation here in the province of Ontario, it is actually underway. So back in 2021, the Ontario government passed a bill. It hit royal assent, which means it has to happen, for the regulation of personal support workers. It is under Bill 283, which is the authority, is what it's going to be called, the Healthcare Authority, which falls under the Ministry of Health here in Ontario. And it's not like a regulatory college. So let me point that out right now. It's not regular regulation of the PSWs. It is a form of regulation. So there will be a standard of conduct, standards, practice that you would have to adhere to in order to maintain your license as a personal support worker, etc. And there will obviously be a complaints and discipline process as well. We are very unsure as to what that looks like at this time, but I have a message from the Ministry of Health, and they wanted you guys to know that it is on track. They are on track to regulate the PSWs ASAP. So that was our meeting yesterday with the Ministry of Health, and that was a very promising message down to the PSWs. They wanted us to share that with you guys as well. Second piece, today we met with the Ministry of Long-Term Care. We've been doing that a lot lately. And there is going to be an announcement tomorrow about PSWs in Ontario, so please stay tuned. The announcement will happen at some point tomorrow afternoon. So we look forward to being able to actually talk to you guys about that once that occurs. Unfortunately, we're embargoed, which means we can't say anything about it until after the official announcement happens tomorrow with Minister Cho, Minister Jones, and Minister Dunlop. So we're looking forward to being able to chat with you guys about that as well. And just so you're all aware, yes, we get very frustrated that we can't share these things right out in the open as quick as possible with you, but just be assured that we have your best interests at heart, and we are definitely still fighting behind the scenes for many things, like a living wage, full-time hours in long-term care, a ratio in long-term care, etc., etc. So with that, I'm just going to go right into kind of what's been going on here at the OPSWA. So At the Ontario PSW Association, we received money through the Ontario budget this year, 2023, to launch a campaign to recruit, retain, and educate about personal support workers in the province of Ontario. Since then, we have hired PSW ambassadors, actual personal support workers, who have been very diligently and very loyal in their quest to spread the word about PSWs and engage with the public. They have been literally everywhere across this province, haven't they, Ian?
Everywhere. Oh, yeah.
Yeah, everywhere from Ottawa, Cornwall, down to they've been in Chatham, they've been to Sarnia, they've been Niagara Falls, they've been all the way up to, and we haven't gone as north as we want to yet. It's not over yet. We're still coming way north, but they've gone to North Bay, they've been in Sudbury, they've been in Barrie. These ambassadors have done nothing short of phenomenal work since they hit the ground running in the beginning of August. We've done over 100 events and job fairs since the beginning of August, so that might explain why we always look tired at this point, because trying to organize all that is definitely has been a coup. But needless to say, the public loves PSWs. They have nothing but really positive things to say about the personal support workers, and the definite separation between us and any other healthcare professional has been a success. So people know now that PSWs are not nurses and nurses are not PSWs, etc., which was one of our goals leading into it, because everyone has their specialty and the PSWs have theirs, and that is we own personal care. So it's been a very fun and exciting adventure, I guess you could say. It's not over yet. This campaign goes to March of 2024. So if you want these PSWs in your region, please email us. And I'm sure we can put the email below at some point, but please email us and let us know where you want them to be. They're going to high schools, they're going to community colleges, they're going to events in different regions, they're hosting job fairs. There's free PSW swag, which I know a lot of you guys are insane about. We're also going to be doing a pop-up in Windsor. So Windsor, we're coming to you. I believe it's December 7th, 6th or 7th, we're going to be in Windsor for a pop-up, a swag pop-up, which means we're going to have lots of free PSW swag. You can come in, you can chat with our PSW ambassadors and get to know the association a little bit more if you want to, or just grab some free PSW swag and wear it with pride. So with that, Ian, there's more about the association, I think. What else is going on?
Well, for me, from an operations point of view, we're continuing to move forward with a number of our membership initiatives. So we're still trying to find homes for a lot of our international workers. The one big thing that the association has done now is we've been asked to comment on the role of resident support aides in long-term care right across Ontario, with regards to whether or not they need to, 1 minute, please. Sorry. In regards to whether or not their role is in Ontario. So what we've been recommending at the association is, because we've been getting a lot of feedback from members across Ontario that there's some concerns with the resident support aid. So, and relating them and having to take on responsibilities to train them and etc. So for those who are not totally aware on this topic, the resident support aid was introduced in 2020, right at the beginning of the COVID. The premise of the program was that individuals from the public would do a course through a provider in Toronto, and then be eligible to work as paid resident support aides, providing care for low acuity care for basically companionship and traditional volunteer roles, but this time they'd be remunerated. During the COVID, that role was of some value to the members and to the public. But since that time, however, we're recommending that the role be basically wound up, and the duties placed back on the PSWs. That's based on the feedback that we've been getting from members and those of us who took the time to connect with us. So if anyone on this call thinks that's a bad idea, we apologize, but that's the direction we've decided to go in. At the end, I think we're trying to maintain the integrity of the profession is really the goal, and to protect the investment that everyone on this call made in their own education and training.
Absolutely.
Sorry, I'm coughing a lot. Excuse me. That's the big one. A lot of the energy we are right now is trying to make sure that we get the messaging across. We're trying to make sure that people are aware of this profession, and we're extremely pleasantly surprised to know that people are aware of this, and there's a lot of people who know what the PSW is. So um, yeah, it's been encouraging the last little while. It's surprising that the
They
support.
are so excited when our ambassadors are out in public. I cannot convey that enough. They are so excited to see the ambassadors and engage with them. And, you know, it has definitely been heartwarming. We attended two separate parades this last Saturday, one in Cambridge, Ontario, and one in Niagara Falls. And I was the one in Cambridge, hometown. Here I am. And it was almost emotional to hear the praise from the public towards the PSWs that were with us. So it was a very it's and and the reason why we're telling you guys this is because you have to remember, even though there's so much stuff going on and there's constant, you know, it's never good enough, right? And I don't know if it ever will be, but we're trying to make it as good as it possibly can. There, everyone has their issues, but the one thing that stays consistent and one thing that we are seeing is that what you did through COVID and what sacrifices many of you made and the dedication that each of you show to those in your care, you think people don't notice. And they do.
They do.
So I know that doesn't fill the bank account up, you know, or but it's you know, you become a PSW because you want to make a difference. At least that's why I became a PSW. It's because I wanted to make a difference. And it's very promising when you see that you are and you have made a difference in so many Ontarians' lives, like it unbelievable amounts. So very, very promising. I do ask that if you have questions, though, please put it in the chat because we're not going to open up the floor to anyone to talk during this webinar. Otherwise, we could be here all day if we do that. So I guess with that, one more thing, Ian, I just wanted to mention, just for everyone on this call, if you're not aware, in the beginning of September, we have a new broker for our insurance. So now we offer a minimum of $2 million professional liability insurance on all of our memberships. I mean, obviously we have more on the entrepreneurial membership, and we obviously still offer the family managed home care insurance that so many direct support workers require in order to work directly with their clients. So we still offer those as well, and membership is still tax deductible. So that's my little pitch in the middle of the town hall.
So yeah, please feel free to ask any questions now. We're all yours. The one thing I would like to touch on right now is our reintroduction of the refresher course, which is coming for next week. So for those of anyone who watches this later or now who's paid, you are eligible. Of course, this is the time to do it. We can accommodate you. Now there will be more dates coming down. We're not quite sure how many before the holidays start, but we at least will have one before the end of 2023. So there is at least some things that are happening there.
So the PSW refresher course, just for people that don't know, this is a 12-hour online, literally what the name says. It's a PSW refresher. This is not a PSW certificate, nor can you take it to work as a PSW in long-term care, home care, anywhere without your actual PSW certification. So just to make that point clear to everyone, because there's been some confusion in the past surrounding it. So yeah, that's offered next week, right, Ian? I think, yeah.
27th, 29th, 27th, 28th, I think, if memory serves.
Yeah, it's a great refresher. It really, if I was going back into the field, I'd be taking it myself. So
Well, it's important if you've been out for a couple of years and you really want to make sure that you have those skill sets that you might think you have, but when you take them again, you realize, oh shoot, I didn't realize, I forgot that. So that is going to be something we've heard a lot back about.
So a couple other things that we are bringing to the government's attention, just because no one wants to ask questions right now. So I'm going to just launch into some stuff, is some of the issues that we will be continuing to address, like we did say, is ratios in long-term care facilities, full-time hours in long-term care facilities, but we're also going to be looking at home care. Now, one of the things that we do for home care to fill the need right now, because when I say it's a mess, is our entrepreneurial membership. So we enable personal support workers to work for themselves as their own bosses in home care. If that's something that's of interest to you, please reach out to us or look on our website and our entrepreneurial membership. You do receive full support from the association, meaning that you have us to back you and guide you and answer the questions that you may have about working for yourself, as well as fellow PSWs that are actually entrepreneurs themselves and have made it a success. So if that's something that you want to adventure into, please go ahead and look on our website. I think it's a great initiative. Ian, what do you believe?
I think it's excellent. I think it's an absolutely excellent initiative. The oh, I just lost what I was going to say. It's coming with age. I apologize. If anyone has any, I guess my question to those present is, anyone have, what is the major issues that you personally are dealing with in your explain work setting, I guess, is, and what, why do you think that is? What is the current issue? We're seeing a lot of issues coming into the association right now. So if those who want to jump in, just throw it down there. But accessing childcare is becoming an issue for a growing number of members. So we're seeing that as becoming an issue. Money is an issue for everybody in Canada right now. So we get it. We just are not positioned to collective bargaining. So that's not what we do. But we get it. There is going to be some relief. We know there's some good news coming down the line for some of the PSWs right now. We can't disclose it right now, but there's hope on the horizon. Let's just say that. So that is one of the other things. The other area that we are going to be not pausing our attentions on, but pausing development a little bit towards, is until next year, is going to be, we were offering a mental health support. We're going to be retooling our mental health supports a little bit a lot completely. We're working with our current provider to figure out a better way to outreach. And what we were finding, and this is not something that I'm encouraging anyone to jump into right now, but there's a lot of hesitancy to discuss mental health issues, burnout, and we really want to get to the root of that and set up an opportunity to figure out why people are having such problems in healthcare, and breaking the difference between what is a mental health issue and versus what's just being upset about something and being bad. So there is always those definitions that come into. So that's the big one that we're dealing with.
Yep. And I guess we should also announce in the same token that masking is back in long-term care facilities. So if you, chances are you guys all know about that here, but the COVID numbers we're seeing, we met with the Ministry of Long-Term Care on Monday, and the numbers that we're seeing in long-term care homes in relation to COVID are larger than what they saw in 2020. The media doesn't want to touch it. No one wants to deal with it. Frankly, I think we're all sick of the word COVID. I know I am, everyone is, but that's our reality for the PSWs in long-term care. And so with that being said, you guys will see some information, some support coming out from the association, just to, public awareness, which is extremely important, in relation to masking. I mean, I know I have a mom who, she hates wearing a mask and doesn't want to go back to that time in her life. And unfortunately, we just might go there. We don't know yet, but definitely right now in long-term care facilities. And I mean, guys, it's also flu season. Everything happens. We're used to it. When I worked in long-term care, it was the same thing. So just to let you guys be aware of that, if you don't know already, because we posted it yesterday and a lot of PSWs actually did not know. So I would definitely take precautions. Is COVID vaccinations mandatory for PSWs? Depends on your employer, Hope, but I would say 99.999% of employers, yes.
So Sarah, the next question. Yay, we're getting questions. This is great. Bring them on.
No, let me just finish answering this a little bit. Just, it is yes, Hope. And I know not a lot. There's some PSWs that don't want to get vaccinated for different reasons, like whatever. It could be religious, it could be just personal choice. Teach their own, it is what it is. But unfortunately, working in healthcare, they expect vaccinations. So that's I can't give you a better answer than that, but yes.
We here at the OPSWA, we worked with the PHAC. We had Dr. Tam come on. We had a very comprehensive discussion about the value of vaccines. Miranda and I were both around when the SARS came in, and we know that they've been working on the vaccine since then. So we get the disconnect, but we really don't have a great deal of room for non-objective, non-realistic anti-vaccinations. It's not really something that we don't support at all unless
Well,
there's.
no, and you know, due to the fact that we're a public, not-for-profit, federal organization, we have to follow public health protocol. And we are partnered with the Public Health Agency of Canada, so it's kind of important that we kind of follow what they do. But yeah, no, Hope, thank you for that question, because you know a lot of people don't have the guts to ask it. So I appreciate the fact that you did ask that. The next question, go
Oh,
ahead.
actually, can I just add an addendum to that?
Yeah.
Hope, if I can just add, we've also the ops with the Canadian Sport Workers Association, our parent branch is working with the International Federation on Aging right now on an ECHO series that actually promotes vaccinations for all age groups as a preventative element for medicine. So we're very much embracing a science-backed encouragement for all people, PSWs, to get vaccinations, flu, hepatitis, whatever vaccination, we encourage you to get it. It will benefit long-term health. The numbers speak for themselves, and we can we're proposals. So next question from Sarah Jones. I am start. Do you want me to read it? Can I do this one? Or? Okay. I am starting a new PSW job position. Congratulations. Do I need to let the employer know of my OPSW or my OPSO membership? You don't need to let them know about your OPSO membership. If they ask, you're welcome to say it, but it's really not it shouldn't be a material implication in getting or not getting that position. However, it's no harm in letting the employer know, and I might encourage them that you have full insurance and are fully vetted with the criminal reference check. So there's nothing to be ashamed of. I hope that's not the question.
No, can I just point out, Ian, though, that for a lot of people on this call, professional association means credentialing. What that means is we are the only body in Ontario that certifies a PSW, that we say, yes, this person is a PSW. Yes, they did go to an accredited program. Yes, they are not, you know, an axe murderer from Alberta. That's my line. I always say it. That, you know, and that you carry insurance. So we are the only credentialing body in Ontario for that. So that's where we always say, tell your employer, because, you know, I mean, or don't tell your employer, but at least you're safe. So welcome to the team, Sarah. Seriously, that's awesome.
Yeah,
Ian, this next one's for you.
does OPSWA help internationally trained doctors and laboratory professionals? This is an excellent question that I deal with every single day. Yes and no. So let's talk. The OPSWA runs what we call the international grandfathering program, which is now being called the Legacy. So the way we see it is that certain healthcare professionals across the globe already possess the necessary skills to work as a frontline healthcare worker and deliver personal care in Ontario. As such, we'll extend our certification, membership certification, to include those individuals. We don't offer a PSW certificate. This is where English is fun, and we don't offer a certificate, but we certify PSW. So that's now, as for the crux of the question, comes down to laboratory professionals. Now, when you're dealing with when it comes to our assessment process, what we look at is to see if that education embodies, or is there any time when you were becoming that laboratory technician that you did an internship, for example, in a hospital, and are you able to, while you were doing the internship, did you provide personal care, such as bathing, toileting needs, activities of daily living, feeding techniques, those general things? If you do have a laboratory tech, and that was a required part of the program, and you can document that and we can show it, we can extend membership in those cases to those individuals. We recommend that they take a PSW refresher course that we offer to give them for their own sake, so they have the skill sets. But yes, so it depends on the laboratory professionals. The doctors, generally physicians, surgeons, they're generally quite well possessed to maintain to have those skills. So they're more than welcome to join us. So for those who don't know yet, our program is it's voluntary. It's used by a lot of different companies across Ontario to work as a personal support worker without necessarily going back to having to retake the PSW course. However, if you are an internationally educated person and you're currently enrolled in the PSW course, well done. You're doing great. We ask you to stay there, graduate, and then please don't leave the program. We really encourage you to stay there. Please do. So it's just to offer some supports and flexibility while you adjust to Canadian life.
Yeah, and let me point out too, there's actually going to be another announcement coming down from the government, I believe next week or the week after, about some training for IENs or international healthcare workers to upgrade their skills to PSW to remain working in long-term care facilities, etc. So stay tuned. I don't know why the government decided to like wake up this week, but they did. And now suddenly we're just barreling into the holiday season with a lot of announcements and a lot of incomings from PSWs or from the government for PSWs. So exciting stuff, does anyone have any other questions that we can answer for you guys? Hit us with some hard ones. Does refresher course cover medication administration as different expectations?
Good question. Oh,
yes.
Thank you for bringing that up. Do you want to talk or do you want me to go into?
Sure, I can if you want. No, it doesn't. That easy peasy, Eleanor. That's it. It doesn't. However, the OBSWA is working with. Who are we working with, Ian?
Sorry, it's called Ontario Talent.
Ontario Talent on a micro credentialing. A micro credentialing program or course for PSWs in medications. I don't know if all of you here are aware that the Ministry of Long-Term Care has put forward as a policy stating that PSWs can administer medications, non-controlled medications, okay, in long-term care facilities. We ensured that there was two I guess kind of things that had to happen in order for us to agree to it. And one was that you have to take a medication course, and it's not like a one-day medication course. It's like, in depth. And two, that if the PSW is not comfortable doing that in long-term care, they can opt out of that extra duty without getting in trouble. So both of those things are in that policy. But expect some I would be really careful with medication courses, guys, because some are good and some are not good. And so always make sure it comes from an accredited program, an accredited school. And if you can, stick kind of more to the community college sector to ensure that you're getting what you need, that or schools through the NACC. So yeah, absolutely. Hope that answers your question.
Well, the good question. Will we provide the course once approved? I think currently the way we're structuring it is that we're going to be working with a third party, an educational deliverer, an actual college, and that course will be delivered, or at least be one of the recognized medication delivery education courses. The one thing I'd like to stress, if I can just talk, we don't normally talk about wages at the OPSWA. But when we were looking at doing the medication, we did premise and we did strongly encourage that if you are going to be delivering medications as a personal support worker, you should be entitled to additional money per hour. So we've heard some evidence of companies that have honored the principle of this, but really broke the spirit of this. So two things about this I want to reiterate. If I'm repeating myself, I'm sorry. Miranda's already said this is voluntary. If you are not comfortable doing this, even with training, you don't need to. You can say no. Second, if your employer is offering you a nickel or a dime an hour to take on this additional responsibility, before you just sign on and before they use bullying tactics on you, this is where you need to contact the OPSWA. Please don't hesitate to do so. This is an extremely predatory behavior. We had an example of an individual, Miranda, do you remember, who was told that they get 10 cents an hour extra for doing the medication. They had 2 hours of training and that was it. They were ready to go.
Yeah. And don't take on that responsibility, guys.
Why? And it is online, Jenny said, but we'll get you the link in a second. But no, you want to make sure that that you're comfortable with the wage. If it's 10 cents and you don't want to do it, then don't. And if they're going to say they're going to fire you, contact us and we'll see what we can do. Give you some.
You guys definitely have a banner. And what I mean by banner is a banner of advocacy under the OPSWA. We are in with the government, and bureaucracy as well. So not just government, but also bureaucracy, where we can talk and we can relate things and we can go and say something. We are your body in that aspect. Even if you aren't a member, you can always come forward to the association and ask what your rights are. It's important that you guys know your rights as PSWs. You have a right to say no to something that you are not comfortable with and does not fall under your scope of practice. Now, that being said, we do have the roles and responsibilities, is what we actually call it, on our website with the standards of practice as well. And I invite you guys to have a look at those if you are ever kind of wondering, can I or can I not do this task? Does it truly fall underneath my scope, or is it a delegated task? So I hope everyone on here knows what a delegated task is. I'll just run it by real quick. Is basically when, I'll give an example. You're working in home care for Mr. Smith, and you're working through an agency, and your supervisor, who is a nurse, comes in. Mr. Smith has a bubble pack of his medication, and that nurse trains you on the bubble pack for his medication because he cannot give it to himself. You have to administer the medication to him, whether through crushed up through food or assisting putting it in his mouth or anything like that. So the nurse will delegate that task to you, sign off on paperwork, and then you are delegated to perform that task for that one client. So delegation is per client. So it's not like you're standing in a room full of people and the nurse says, okay, now you can do it for everyone. That's not how that works. The delegation is per person, because when you're delegated, that responsibility, that delegation falls underneath the nurse's license. So it's, I hope everyone kind of understands that. I hope that that kind of clarifies some things for you guys. There you go. Perfect. Yeah. So that, yeah, it's important that we know these things, right? I work for myself. I was wondering if there's someone I can direct accounting questions. Yes, absolutely. You can contact us, Lily. Apparently it's end of day for us, and I apologize because we're mixing our words up, but absolutely, Lily. Just reach out to us at our info@opswellwebs.com, and our staff will direct you to who can assist you, which chances are will be Mr. Ian, who is sitting here currently. So, so absolutely, please do.
Generally, any expense that you use to generate business is coverable, but we can talk, we can set something up if you need help with that, no problem. Oh, Miranda, you want to do this one? This
Sure.
one is tough. Yeah.
So, Pauline, thank you very much. Love your last name, by the way. What is the general rule around workers driving clients in their personal private vehicle? Also, the worker driving to an appointment in the client's or family member's vehicle. Are you driving, Pauline? Just really quick, I just need to, are you driving their vehicle? This is something that the general rule is you should talk to your insurance provider when it comes to your car insurance to ensure that you have, to ensure that you have proper insurance on whomever is going to be driving that vehicle. I think it's a little bit more insurance that you require in order to drive around a client. I'm not positive. If you're driving someone else's car, it'd be your insurance that would fall under if you were in an accident. So as an employer, so you might want to talk to your insurance provider surrounding that. If they say you're good, then you're good. Really, it's all about who your car insurance provider is at that point. It doesn't fall underneath the professional liability aspect, unfortunately. So I hope that answered your question. Okay.
Yeah, we will connect you if you need assistance with that. We have two other.
Absolutely.
Are there LMA? Yes, absolutely. There's someone anonymous question. I'm going to answer. This is regarding LMIAs. For anyone who's not aware, LMIA stands for Labor Market Impact Assessment. The Ontario PSW Association works directly with Synergy Labs to actually assist people with getting LMIAs. If you need help with that, we can provide you with the direction of how to get in touch with them. But we actually have very little role in issuing LMIAs directly. The OPSWA is not an employer, so we are not allowed to issue labor market impact assessments. That being said, your chances of getting a positive labor market impact assessment to work in long-term care is extremely favorable right now. It's a good chance that you'll get it.
Yeah. Yeah. The amount of people we need in long-term care and in home care in this province, and I mean PSWs, is astronomical.
And you want to think, yeah, and for those who are out there that, sorry, I didn't mean to cut you off, think flexibility. I mean, there's changes coming. You might want to think about what is it that you might want to do and things like that. So definitely just listen to some announcements that are coming over the next 2 weeks, and there'll be some positive things.
Absolutely. And I don't know if everyone on this call knows this, but did you know that you can specialize as a PSW? I mean, everyone says the next step up is nursing. And if you want to become a nurse, please feel free to go become a nurse. We welcome it. Awesome. My goal is to keep you guys here.
Sorry.
That's kind of our goal, is to keep you guys as PSWs. And so there's actually so many opportunities to specialize as a PSW. I myself, I'm a Mohawk grad, 2006, not to age myself, but I ended up, before it was even a thing, I became a mental health PSW. So I worked primarily with people that had mental health issues, shall I say. So as a PSW, you can become a perinatal support worker. You can become an autism support worker. You can work in the schools as an EA. I mean, oh my gosh, the sky's the limit to enhance your education as a PSW. Dementia and palliative care. Yes, yes, you can. You can absolutely do those as well. I mean, honestly, guys, the sky's the limit. I like to say that, you know, the PSW program that we all took is kind of the beginning of our careers, our professions as personal support workers. And the sky's the limit. You can make it to what you want it to be. You just got to know where to be, and that's the ops walk, because we will guide you, help you. If we don't know where it is, we'll find it with you, so that we can help you grow in your career as a PSW. Absolutely.
And that's exactly.
So
We want to
yeah,
build, and if I may, this is something that we think that really should be a career. You should be able to make a career out of becoming a personal support worker. And
absolutely.
for those who really, really, really just have to become nurses, no harm done. Let us know. We can connect you with WeRPN and the Begin program, and there are things we can connect you with. We're not, we get it.
Absolutely.
For those who want to
Absolutely.
join us, we encourage you to.
Yes, please stay. Okay, so the question again from Miss Pauline: what about private agencies getting the $3 from the government for our workers? Okay, again, I hate to be the bearer of bad news. Unfortunately, private companies will not be receiving the $3 wage enhancement from the Ontario government. When we fought for the $3 wage enhancement and won it, it was strictly for the public sector. Because, and so I asked questions too, because that's what I do. And I said, why? And they said, because it's public money, therefore they have to follow the money. The money has to be funneled through the public system, in this case, so they can follow the money to ensure that the money gets where it goes, et cetera, et cetera. So unfortunately, yeah, I get asked this question all the time, Pauline, and I am sorry to say that unfortunately private companies will not be receiving the $3 wage enhancement for their workers. It's no matter what we've said and done, we can't break that barrier. It just won't happen. So I'm sorry, but
Yeah, it's not about them not liking the smaller employers, but they have a pre-qualified process pool for people that they've been working with for a decade, 20 years, some of these companies. We get it, but the last time this happened was when it came through a federal initiative, and they were able to direct the money directly and bypass it. But I think the real issue comes down from a public point of view of the optics of handing public money to private companies to deliver public care. That's a lot of the issues that are coming up with regards to the clinics right now. So I think at least that's the feedback we've been getting. So I don't know. But
yeah, and I hear you, Pauline. It is hard for you to compete. Absolutely, it's hard. I mean, you got giant companies out there like Bayshore and Care Partners and Paramed, et cetera, and they are giants, and they do monopolize the home care sector. However, they don't monopolize the private. And so what I mean by that is that they don't have a lot of private care clients because people can't afford their rates. And that's where companies like yours can swoop in and start taking in those private clients. And you know what? And that pool is getting bigger and bigger and bigger because people can't even get the care on a public level because there's no PSWs to give the care. It's really home care. Ian deals more with home care in the association because we've had a lot of battles with them and we continue to around surrounding home care. But yeah, I mean, it's government is different, but we're also happy to help you. Pauline, if you're a member of the association, even as an accredited partner, if you're an employer, we're happy to assist you and see where we can help. Funds directly to the clients.
that's our goal. Believe it or not, we believe in that.
Yes, we would actually prefer if the government gave the money directly to the clients, and the clients then hired who they wanted to hire for their care. Now, there is the direct care program or the passport program, but that is more so for people with disabilities, and it's through the Ministry of Community and Social Services. But that you as an employer can get onto that program, but contact us and let's see how we can figure that out together. You can be a part of that program as well.
Lorna, I think you sent me this email. I haven't got a chance to answer, but I have it now. So hello, Lorna. Could a PSW work with specific need clients? If not, what program should the PSW be enrolled in to qualify them to care for these clients and their behaviors? Ooh, that's a good question. Where to start? Do you want to take it and I'll add it at the end, or do you want?
Sure, yeah, absolutely. As a PSW, you should be able to take on specific clients depending upon what their needs are and if you're comfortable with performing that care and supplying that care, Lorna. So I think it depends, right? Like I have we have PSWs that work only, like one of our HR manager, Debbie Jensen, she in her career as a PSW only worked with children with disabilities or young adults with disabilities and children on the autism spectrum. And so basically, yeah, like she knows that's what she was comfortable in. Now, if you're not comfortable with it, there's always different organizations and associations out there that supply additional training. I would need to know more about what specialization they require for me to really truthfully answer your question. But go ahead, Ian, if you want to.
Well, I mean, if you're looking to hire somebody to perform these cares in someone's home, the one thing you could look at is hiring a developmental support worker. That's actually a PSW that has an extra year of training that works specifically with these developmentally specialized care groups. They're perfectly trained to deal with this. They know all the complete thing. Now they're even harder to come by than PSWs, but they are there. If you were to issue a DSW job and you need assistance in posting that, we can assist, of course, through our own channels, but it's you'd be looking at a DSW, which would be the next stage, or having someone do the specialized training depending on that. So
okay, actually, you know what, Debbie, did you want to talk about real quick about something about the training that maybe you took as a PSW to work with specialized individuals? If Debbie's here. Oh, here she is. Oh, nope, Debbie's not here.
I don't think she.
I
So
don't. Oh no, here she is.
oh, here she is. Okay.
My camera.
Yeah. Oh, hi, Deb.
So there's actually a course that's in Aurora. It's through the Alzheimer's.
Alzheimer's. It's been a long day. Yeah.
Yes. There's a course in Aurora that I took through the autism place.
Yeah.
Honestly, can't even remember the name of it. And it was strictly with dealing with children who have autism, and young adults who have autism. And it was pretty much like they give you ideas of a box that you can fill of tools to deal with certain situations, gearing towards right from the beginning of the spectrum to the end of the spectrum. And it's little things of making sure that you have like little gadgets in your car that you can like just pull out and be like, here's a puzzle to do, or here's like a car to play with, or here's like pictures to flip through to distract whoever it is that you're working with.
Okay, awesome. Yeah, so see right there's a lot of things that you can do out there and reach out to Debbie or our ambassadors even, because they're in all different places across our province and they're able to assist you as well with trying to find things that you may need. Thanks, Debs. So we have 3 more questions here. I'm going to start because Sarah Jones was first. It says, clarifying, is there another $3 wage increase coming, or was this a $3 increase from during COVID? So this was the one from COVID. There is no $3 wage increase coming to PSWs again. Sorry. And then we have, oh, Did you already answer that one?
You can feel free to read the answer. I'm just trying to make sure we only have 15 minutes left, so I want to make sure they're getting
No, but
it.
actually I do want to answer this one from
Go
Gary.
ahead, yeah.
Because, yeah, I'm sorry. So Gary is one of our entrepreneurial PSWs, and he asked if he able to contact the former LHIN Home and Community Care Support to get clients that are not being taken on by the bigger home care agencies. So funny you bring that up, Gary, because we actually had a meeting with the Ministry of Health yesterday, and we were actually asking about that. Now, that being said, what's happening currently with the Ministry of Health and Ontario Health and Home and Community Care is that they're all amalgamating into one giant Ontario Health kind of conglomerate. And we can't get any movement on entrepreneurial PSWs accessing public clients until that happens. So you can approach them. If you get in, great. I mean, it's like a hit and miss, really. But our goal is to embed our entrepreneurial PSWs into that process as well. So just to let you know. Yeah. And then really quick, Pauline, yes, we do certify DSWs.
We certify all frontline healthcare workers under the NOC code 4211.
I think we have another question on
About IENs. I answered it. Well, the question was, are IENs allowed to work as a PSW? Strictly speaking, yes. In home care, absolutely, they fully qualify. Long-term care would depend on if you're a member of the OPSWA and whether or not the long-term care home is open to accepting international nurses. It's that simple. If they are, then you're good to go. But you have a better chance if you want to join through the association. We can directly connect internationally educated nurses.
We have lots of partners, lots of stakeholders, direct contact with the government. These are all really good things. We didn't have them when we started. It's almost 14 years ago, this trek, but now we do. We're sitting in a good place, but change still takes time, unfortunately. And healthcare in itself is a monster. And what I mean by a monster is it's just a giant file within the government. It's the largest ministry, and they even split long-term care from health, believe it or not. And it's still the largest file. So and PSWs are a big part of both of those ministries, as well as community and social services and labor. So we're not busy at all.
No, but it's hierarchy. We too fight against the hierarchy of healthcare workers, which we're very much aware of. So we get it. Just a question, anonymous. Can individuals globally become members of OPSWA? No, not really. Yes, you can join maybe as get on the mailing list, but really the key element is really getting our insurance, and the insurance is only eligible if you live in Canada and work here. So while yes, you could apply, you can pay the money, it's just not going to do you absolutely any good. So yes, but I wouldn't do it at all.
Yeah, because you get your handy dandy badge too as an OPSWA member, and
we can't give that to you if you live here.
Yeah.
So
we can't give you the badge if you're global. So if you're somewhere else in Canada.
Yeah, a good question, but you'd be legitimately just paying for an administration fee to get you nothing. And as much as we're a nonprofit and we need resources, we're not doing that. So please don't. We're sorry.
No. Sorry.
However, if anyone on this call does need assistance, is calling from overseas, which is fine. Please email I've left my email in the chat, and we can direct you to our partners who can assist with answering questions as for job markets. For those who are members of the association on this call, please look up. We do have a legal helpline for questions you have regarding workplace rights. Don't hesitate to use it. It is available for your resources. So great place to also ask about those tax questions as well, but we'll email you as well.
I'm also going to answer a question that we get all the time. I just remember it popped in my head. Is I don't know if you guys have noticed our PSW OPSWA ambassadors wear OPSWA scrubs, and they were given to us by Mark's Work Warehouse, and they're branded with OPSWA, and they look really sharp. And a lot of people have been emailing us or messaging us on Facebook asking where they can get the OPSWA scrubs. Unfortunately, right now, there is nowhere for you to get the OPSWA scrubs. We are working with Marks to get it as a part of their scrub club, which they said hopefully by early next year, you guys will be able to purchase those scrubs through the Marks Scrub Club because there is so much demand. So thank you for all of that demand. yeah, it's pretty crazy to see OPSWA everywhere. How do you get involved in OPSWA ambassadors or other involvement? Okay, awesome. So unfortunately, there are no positions for OPSWA ambassadors currently. These ambassadors are actually under the Ministry of Long-Term Cares campaign that I talked about earlier, the I'm a PSW / join the PSW force. They're part of that campaign. But we do have a professional advisory committee that you can join as a member of the association to have your voice heard directly to us at OPSWA. We rely quite heavily on our advisory committee for what to say to government, what to bring to government. We want to bring your words. We want to bring your issues to government. I can't go in there and just talk about what I want, because I know we have to go in there and talk about what you guys want. That's what our job is. So if you want that, you can email us at info@opswa.com. And they're currently actually still doing interviews for our advisory committee. So if you're interested in that, make sure to email and one of our ambassadors will get in touch with you. Absolutely. And what about any other merch? Yeah, we have more toques coming, because I know you guys saw some of the toques on our ambassadors, the I am a PSW toques. So we ordered some, so we're going to have those up for sale soon. We also have our lanyards. So we do have Ontario PSW Association lanyards as well. And hopefully we're going to be having some more merch starting in early 2024. So stay tuned for that, Lily. Thanks for that question. Love the toques. They're coming. We're getting them. They're coming beginning of December. You guys will be able to grab some.
I'm going to look at this one. If I can just jump in here. One of my
Yeah.
clients is covered by her private insurance. However, the insurance company won't pay for the visits unless they have a copy of my personal support worker certificate. Okay. I'm tracking it down through the schools. I don't know where mine is as I graduated in 2010. That's a great question. You'd have to go ahead.
What? Sorry, Ian. Diana, contact us.
Yeah.
Because a lot of people, I lost my PSW certificate for the longest time, and I had to call up Mohawk College to get my certificate again. But it depends on where you went to school. Unfortunately, we have people that went to a school that shut down, that didn't have an accredited curriculum. So like, but if they did, like if you went to Everest, which I doubt anyone here is going to remember Everest, but if you went to Everest, that school shut down, but all the PSWs did the NAC exam. So NAC still has, they have, proof that you took the course and that you passed.
Email us.
Yeah,
That's
please,
the big.
just contact us. Yeah.
If not, we might be able to write a letter or something, but I don't know if the insurance would take it unless we were to demonstrate that. We might be able to offer some assistance, but we'll see what we can do. I can't guarantee.
I also called you and left a Monday message regarding this on Monday. They also want my registration number, ? Oh, so they might want you to be an OPSWA member. That's what the insurance might be looking for, Diana. I'm not sure.
We've been advocating to have insurance companies make sure that PSWs possess professional liability insurance before they go into people's houses as a qualifier to protect the insurance company. So it could be one of those things, but no one tells us anything, so that could be what they're
We're
doing.
always the last one to know. And just please keep in mind too, Diana, that our messaging system is just that. It's a messaging system, so our call system. So our team doesn't check the messages unless it's a Monday or a Friday. If they missed your message, I apologize. The best way to get a hold of us, seriously, is to email or find us on Facebook and send a message to our page on Facebook. Those are the avenues that are most monitored with the association currently. Next question is, any idea PSWs who work in private long-term care will make the same wage per hour as government-run home as the gap isn't close? Private long-term, are you talking about retirement homes?
Yeah, there's no such, Alex, there's no such thing as a private long-term care.
Private long-term care, no. All long-term care is public. All long-term care is public. So you must be thinking private, like private meaning retirement homes. So no, there will never be a wage gap. It's up to the retirement home to meet the wage, which I think they should meet the wage of a long-term care facility. It's up to them because retirement homes fall underneath a completely different ministry and completely different act. It's a long-term care home. Okay, Alice, can you email us, please? Because I'm a little bit
Because
confused
it could be
because
a private company running an LTC home, but that's still considered a government-run facility. It's just running, they're using a private contractor to run it.
yeah, that's a possibility.
So
Yeah.
they could be that you're operating as a subcontractor through that private company, which is running the government contract, and that's why they're not paying the wage. That could be something that they're doing.
Yeah. And Pauline, no, they don't. And then no, it's not, Eleanor, the distinction is not profit versus nonprofit. It's that's not the distinction. It's public. So it doesn't matter if it's not, because you have two long-term care associations in Ontario. You have Advantage Health and you have the Ontario Long-Term Care Association. The Ontario Long-Term Care Association represents public, all the public, like not public, but like, does that make sense? All the for-profits, I'm sorry, all the for-profit long-term care facilities, whereas Advantage Ontario represents all the non-profit long-term care facilities. But in both instances, they're still public. So that's where I think the confusion kind of lies. I mean, there's a lot of, guys, it's Pandora's box, right? I mean, let's really think about it. It's Pandora's box. Let me see here.
Lorna, I'm answering your question now. I'm just going to put it in here. Okay, so let's talk about the officer's relationship with agencies versus our relationship. We have no issue with employers, with private individuals. Our entrepreneur program, however, is not designed to support an agency model. It's designed to support single PSWs. So the question I've been asked is, if you're an agency, so Lauren, I know your agency, it's a great agency, just FYI, they're great. But if you're looking to do it, the real way to put your energy in it is advertising and connecting with the public and starting to build that reputation with the major stakeholders, which means constantly putting out your advertisements, connecting directly to those long-term care facilities, to hospitals, the administration staffs in those hospitals, and any other, Lauren, I think you're down in my area, so it would be like working with like Ridge Health, the Rouge Valley Network, Health, all those different associations. Just getting that name out there is really half of it. But we can, I know you're having a relationship with us, but we can help you with that a little bit. So when we'll have to email, but I'm going to put it in the meeting. The other area is that you need to become a pre-qualified provider when it comes to MLTC homes. So depending on the size of your agency, you might be in your best interest to become a register with the government, and then you would therefore become a pre-qualified provider and eligible for these contracts. But again, even that can take years to do it, and we don't really have a great deal of input into those processes. We're more focused on making sure people get care. So what you should do is we'll continue to support you best we can to make sure people know about your company.
Best we can do. Okay, so we are now 3 minutes away from the end of this town hall, as I'm sure everyone here has lives or shifts or residents or clients or kids or husbands or wives, partners to get back to. So with that, I want to thank everyone for attending our town hall today. There's a lot of you. We really, really appreciate it. And maybe we can do more of these down the line so that you guys can ask your questions directly to us and get your answers on the spot if possible. So with that, Ian, any last words?
We can try to do one before Christmas, but we can't guarantee it, but we'll try.
There you go.
Last words, sorry.
I'm glad we were helpful. I'm glad you guys named quarterly. Okay, sounds very good. Thank you so much, everyone, and enjoy the rest of your day. And stay tuned for the big announcement tomorrow with the Ministry of Long-Term Care. Have a great one, everyone. Take care.
Thanks for everything, everyone.
All right. Bye-bye.